And that's a very interesting answer too, that what you said in the first half of your answer, that the most common adverse effects are essentially the intended effects of the drug, are the direct effects that the drug is designed to create. That's an interesting point, that essentially the effect that the drug is intended to induce is adverse. And people who begin taking it often don't realize that. And this is a point that I know people, listeners of this podcast have heard me make before, but perhaps it's worth mentioning again that, when you study the history of psychiatry, every treatment that we now look back upon as just insane was described as being effective. And that includes frontal lobotomies, as well as organ removal, as well as high pressure shower therapy, and all of these things that we look back upon and think, who was the insane person there? And when we say things like drugs are safe and effective, or that they work, the super important question is always, what exactly does work mean? Or what exactly are the effects when we say effective? Because the effects have never been that this person is flourishing, that they're emotionally stable, that cognitively they're sharp, that ultimately they're happy and have high levels of well-being and life satisfaction. That has never been the effects that we're talking about here. The effects, of course, are always just a reduction of symptoms, but it's not that the person's well-being has been promoted in any way.
Yeah, I think you raise a really important point. Again, I think, what's buried when people hear safe and effective, they go, oh, it's going to work for my depression. And maybe they assume that I'm going to be better in my relationships. I'm going to have more drive. I'm going to succeed, in my career. And this depression, it's this underlying problem, just like diabetes. And this is the drug that's going to correct the chemical imbalance. But no, these are blunting agents, like you said. And we say effective because they bring down symptoms of anxiety and depression on a rating scale. Believe me, if they were ever able to find consistently that these antidepressants improved job performance or relationships or these other quality of life measures, I mean, they would be shoving it in our face, and they don't, at least not consistently that I've seen. And so, you can reduce symptoms of anxiety, but sometimes that anxiety might be good. That anxiety may be, or there can be collateral damage to muting anxiety, such that you're not as attuned to your partner and your relationship goes down the toilet, or you ignore you no longer see signs from your children that they're struggling and that they need closer attention to truly understand what's going on with them. You might miss that. You may miss things at work. See people become callous. And so there are collateral effects out there which doctors don't monitor for when we kind of blunt people in a way that it makes them feel more comfortable, but at the same time, it's making them less effective in other areas of their life.
Exactly. I think, I've heard many, many experts, Robert Whitaker being one of them, and many others kind of use the analogy of alcohol, and if you think about the effects of alcohol, let's say someone is inhibited in social situations, they can't quite become chatty, they can't quite dance or be expressive in any way, and then they take a couple shots of tequila and they're like, oh wow, I feel way better now. The way that we talk about psychiatric drugs is equivalent to as if we were to say in that situation that this person had this chemical imbalance that alcohol corrected in their brain, and now their inhibitions are released because their brain has been balanced out by this drug that we call alcohol.
Yeah, that's crazy. And I think that's that's psychiatry's dirty secret, if I was going to say, because every time you ask establishment psychiatrist or someone, what do these drugs do? They'll tell you, antidepressants, we don't really know exactly what they do. For a long time, we thought that they regulated our neurotransmitters. Now we think they may stimulate BDNF, its brain-derived neurotrophic factor. They always try and talk about it as if there is a biological issue that is being corrected. And I feel like it's to distract away from the uncomfortable truth that these are drugs, just like any other drugs, and that they have a drug effect, and that can, and while it is fairly constant in most people, it can be unpredictable. It can make people suicidal when they have paradoxical responses. It can make them violent. It can have effects on wide areas of your functioning, and they need to be highly monitored. Because if that got out, that actually what these drugs are doing, family doctors would not be prescribing them. They would only be used by people who, like psychiatrists, who were really spending a lot of time with their patients to understand all the areas that this drugging was affecting in their life so that they could be used in a way that might be beneficial. They don't want to do that. They want to talk about it like it's diabetes. And I think there's a really clear reason for that, because it makes it a lot easier to prescribe and monitor when you think about it as, fixing this mysterious chronic mental illness in a biological way.
Yeah,